My name is Tamatha Gallegos. I'm a certified occupational therapy assistant, and I'm also a certified driving rehab specialist. Driving is something that we address here at the clinic because it's one of the most complex tasks that we do. And so after concussion or TBI, there are many systems that can be impacted to make driving unsafe or more challenging. And so we look at visual skills, we look at physical skills. We also look at emotional regulation, so there's a lot of road rage on the road, and so that's one of the things that's difficult for people to manage after concussion and TBI. And so we put all of those systems together, we evaluate them, and we can train and get people back to the road, or we can make a decision if they're not safe for driving right now, we need to wait for things to stabilize, and then hopefully get them back to driving when it's time. So with the simulator, it's hard to implement real-world situations outside of technology, and so even though the graphics aren't exactly like real world, they're enough that people feel like they're behind the wheel, and so we use this as a tool. We use it to assess attention, we use it to assess concentration, again, visual skills, so if somebody can scan correctly or not, or if they're missing information. And so it's a great tool for us to be able to assess how somebody might look when they're driving a real car. So vision therapy is really important for our patients because there are a lot of visual changes after TBI and concussion. And so those can include, like I said, visual scanning. So if somebody has a visual field cut, they might miss information. You might be scanning your environment and not notice that something is missing out of it, and then you're in trouble walking or driving or reading even can be difficult. There's also focus issues, so those are our accommodation skills. And so with vision therapy, we can really hone in on specific skills so we can increase function. So people can do their leisure activities, they can get back to the necessities of driving, they can do work related. So with our patients, a lot about shooting or being able to drive the vehicles that they're in for military purposes or just clearing rooms even. So there's a lot of implications with vision. Sleep hygiene is kind of an old generic term. We look at sleep overall, so there's several components to sleep, and we use cognitive behavioral therapy for insomnia here at our clinic. And we focus on 4 principles. So the first principle is stimulus control. And so all of these can kind of be thought of as hygiene. Stimulus control is what you're doing with your environment, things that you do before you go to bed to help you get to a sleepy state. And then we also talk about sleep restriction or sleep compression. And so that's making sure that people are spending the right amount of time in bed. So a lot of people will get into bed and doodle on their phone or watch a movie or spend too much time awake. And so that creates a really bad association with our brain and our bed. And then the next module that we teach is the actual sleep hygiene. And so those are components like, what is the light like in your room? Is it warm or is it cold in your room? So more specific to environmental factors. And then the last piece that we talk about is cognitive restructuring, and that's all about how our thoughts affect our sleep. So everybody can relate to ruminating about work, worries, or even if it's positive, you're anticipating a trip that you're coming up on soon. You know, you can lay there awake thinking about things. So it's how we reframe our thoughts to help us kind of let go of that, be in the moment while we're in our bed so we can get sleepy in our bed. So that's all encompassing on the things that we teach. And then with sleep, we also address relaxation. So if we're not able to relax our bodies or our minds, we're not going to be able to let sleep happen. So we do a lot of focus on mindfulness and relaxation to facilitate a good sleepy state. So thinking of a particular experience of a patient having a really profound experience over here, driving patients come to mind. So a lot of times they're unable to drive if they're unsafe due to medications or if it's a cognitive issue or a visual issue. And so thinking of a patient that had gone through vision therapy and was able to learn compensation techniques to actually scan efficiently and get back to driving is huge. So that patient was able to transport their family again, go and do leisurely things. That particular patient was also able to get back to work. So as far as being able to clear rooms, shoot, and do that kind of thing, that he was just able to be himself. Whereas before, that was all kind of taken away from him from his injury. So when I think about why I'm here and patient experiences, I'm really feel a lot of gratitude that we experience this with a lot of our patients. So just a simple scenario where somebody's not sleeping well and it affects you globally. Like your mood is off, you don't have energy for your family, driving is terrible because you have rage, work is terrible, lots of errors, lots of low self-confidence. So when our patients start to get ahead of those sleep issues and they start to get their energy back, their cognition gets better, attention is better, they feel like going out in the public, they feel like being leisurely with their family or their friends. Those are moments that we see frequently. So when I think about a specific scenario, I think it's always geared towards the patients that we have, those frequent encounters that report, my life is better. So, it's all about the quality of life. And so when we hear them talking about that, and it does happen frequently in our clinic, it's amazing. There are so many patients that say thank you for doing what you do, but really we're a tool. We're facilitating them to learn what they need to do to get better. And so I'm really passionate about whatever we can do to help them learn how to do that and understand that they actually have the control. We're not doing anything special. We have expertise information about how to get them there. But as far as getting them their quality of life back, nobody can ask for a better thing than that. It's amazing.